The outcomes of the post-2015 Sustainable Development Goals reaffirms that human beings and their rights must be at the center of sustainable development, with particular focus on women. During the Parliamentary Group on Population and Sustainable Development Forum held yesterday at the State Function Room, it was revealed by the United Nations Population Fund that despite numerous attempts in combating health issues in the country, Papua New Guinea's health indicators is still poor. UN thinks the role of parliamentarians is absolute central because they are the people who can hold the government to account and to bring different stakeholders together to build and forge partnerships these issues. Kevin Dayonga with this report.
Health indicators for Papua New Guinea has been quite poor for many more years. Despite all the effort we put in through the government and through the NGOs, through the development partners, still lots of challenges faced.
Dr. Gilbert Hiawalia from the United Nations Development Fund said the Sustainable Development Goal number 4 on education and Goal number 6 on clean water and sanitation are also captured under the target set.
When you look at the issues affecting the health, particularly women and children are marginalized. They do not have proper access to health services, particularly related to the issue of accessibility and human rights issues.
He added that many mothers and women do not have access to proper family planning, antenatal care or deliver at health centers due to various obvious reasons.
When you look at our health statistics in the last 20 years, 40% of our women deliver at a health facility, 60% deliver at their villages, and that's where they encounter death, and that's why our high maternal mortality is very high.
Mr. Hiawalia further said the most cost-effective method used is family planning. More such programs should be provided for much of the female population under 25 years so they can make informed choices. UN Resident Coordinator Roy Trivedi said a collaborative and holistic approach is needed to achieve and improve the health indicators in the country.
We have to build the right partnerships, and that means working with civil society groups. It means working with government at all levels, not just national, but also provincial, local level government. It means working with private sector groups and, of course, the international community, families and communities. Without the active involvement of people, it is virtually impossible to achieve these goals.
Meantime, United Nations Population Fund said through the funding mechanism established by the government, including the DSIP, PSIP and LLG-SIP, is very fundamental in promoting human development. This will intend to help alleviate the indicators. Kevin Dayonga, NBC National News, Port Moresby.